Good morning.
Good morning.
My name is Llorenç Mateo. I am orthopedic surgeon. I'm not engineer. And I am the chief of the musculoskeletal department in Consorci Sanitari del RAF near Barcelona. I'm the chief of orthopedic surgeon. And Cristina.
So I'm Cristina. I work in the Lean Institute in Barcelona. I'm industrial engineer, and 5 years ago I get specialized in healthcare management and also in lean management file. And well,
we can begin.
We can begin. So we will briefly explain why it's interesting to apply lean management in healthcare. Then we explain you how Consorci Sanitari del Garraf, the hospital where Dr. Mateo works, did it. And we finally briefly shared our lessons learned so far in our learning journey. So many times people wonder if it's possible to apply lean to patients. And so we ask, why not? Because lean is a practice of thinking philosophy which seeks flow for these processes, right? So it is about improving the work. It's about improving processes nurses and doctors work with every day. So despite healthcare services differ in many aspects with the industrial ones, the characteristics of the high amount of processes, complex and interrelated, are not that different. So for example, a patient who's hospitalized for 5 or 6 days in a hospital, he will need everyday treatment, so need prescription from the doctor, then treatment administration from the nurse, then maybe a blood analysis from the laboratory, also an X-rays from the image diagnosis. It will need maybe a specific diet, also social workers maybe with it, hygiene in case the patient is not autonomous, also a clean room every day. So with only this few time, I've already mentioned 7 or 8 different actors, right? So we need perfect coordination, perfect communication. And what happens many times is that despite clinical results are good or very good, there's also a lack of coordination, a lack of flow. And there are scientific articles that says that, for example, in a hospitalization process, only 20% of the activities they did are value-added, are the green ones, and there are 80% of red ones. So we see that there's a lot of opportunity here. When we talk about the red ones, maybe we can talk about a lot of movements due to searching material. We are talking about high levels of stock, reschedulings, cancellations, a lot of bureaucracy, computer program very slow, that doesn't help a lot. And so these factors affect to efficiency, right? And lean can help with that a lot, with increasing efficiency. The problem is that many people think that increasing efficiency means decreasing quality, and that's not true at all. But what is the point of increasing efficiency? We have to decrease quality, right? Makes no sense. So all these things mean that the process, the healthcare process sometimes can have a lot of variability, and this variability can affect to safety, which is one of the key aspects of hospitals. And so here you have some data that says that errors occur, so we have opportunity to improve here. What about the last decades? A lot of hospitals from all over the world have started implementing lean to their processes in hospitals. And so recently we have been traveling a little bit. And so we can say that despite cultures are different and funding systems are different, the organizational problems are pretty much the same, right? So we can rely on the results of other hospitals. So what about the lean transformation in Dr. Mateo Hospital?
Okay, my organization, Consorci Sanitari Garraf, it's an organization who works in Garraf and Cunit, 45 kilometers south of Barcelona in Catalonia. Today it's a region of Spain, but as you know, we are trying to resolve this problem. Yeah. We attend 150,000 people, approximately, and we have 2 hospitals and 1 rehabilitation center, and near 1,000 people works in the organization. While before the crisis, when crisis arrived at 2010. Before the crisis, we are talking about build a new hospital in our region, a big hospital. But when crisis arrived, health system in Catalonia was shaken. And then we have no more money to build a new hospital. And then we decide to achieve or to make a new strategic plan involving the professionals in it. CEO in hospital decided to involve the professionals to build a new strategic plan, trying to be more efficient and changing our culture to be more efficient and to be better.
So if they wanted to do a more transformational thing, they did not only could use specific tools because you can obtain good results, but the sustainability will be limited. So what they did was accompanying the tools for a scientific method also and in a change in a culture and philosophy. So it's more about thinking in a more transformational way. So we will explain that referring to the Lean Transformation framework that John Shook explained on the early morning. And so referring to the process improvement, we try to apply the Lean principles for each project we developed.
And when we changed the strategic plan, we follow 4 principles. First of all, we focus our goals in improve the situation of the patients, but we focus the attention to improve the situation of the 2 types of customers who are in the hospital. The first of all is internal customers, the professionals, because when you improve the work of the internal customers, when you improve the work of the professionals, you improve this improvement impacts directly in our patients. And the second, we should do the process more efficient, and all these should be with the involvement of professionals and continuous improvement. First of all, we create different teams and orient every process and cut the process in little actions and decide all the team. Team was composed by different workers of different areas, and this team decide which of these pieces of the process had value or not. Second, we want to see how the process is currently working. What's the problem? What is the value stream map? Well, what is the process that we are working in this moment? And when we did this process, when we are talking about, we are able to detect the problems. Then the third step was try to create flow. When we identify the waste in each process, we try to eliminate this waste and create flow. 2, in healthcare, doctors always work on my own way. It's our defect. But we try to change this type of work, and we work only when the client, when the customer, when the patient demand our attention. And at the end, we was able to identify in every worker problem solvers, identifying deviation of the standard and learning every time for do new improvements in the work.
So now we are talking about not only improving processes with tools, it is also important in parallel to improve the capability of the professionals, of nurses, doctors, administrators, auxiliaries, porters. And so the approach we took was the learning by doing. It was very important because what they wanted is that in a short term, it was they were able to do that, to continue deploying the philosophy by their own without any external coach or support. So the learning by doing was key point. How did we do that? So we started doing some trainings. What we wanted was to engage people, of course, by removing fears and doubts, so eliminating resistances, right? Because it's like at the beginning, people think lean management, this comes from Toyota. We are not doing cars, we are doing patients, and patients are people, and so it's difficult. So we try to explain what is lean about and what is not about. And so we identify a team of 15 people, the one that were leaders, that were people with a need of change and a need to learn a lot of things. And we did a 3-day training so that they were able to conduct the lean team, the lean projects by themselves. They are called the facilitators. And then for each project started, we did also 1-day training, only 8 hours, so that people who would be affected by the project or possible countermeasures, they knew about what is Gemba, what is spaghetti, just in case if they see people there timing what they were doing, just that so that they know what's going on, right? And then they started to developing a 30-minute lean healthcare, they called. So that is about diffusion, the culture, and more. So that is what it is called the do-it-yourself approach, right? This is the most sustainable way of doing it. And you can see here in one of the pictures, Dr. Mateo, like thinking, what is that about? And now you see him, he's a doctor, he's a physician, he doesn't sound like this, but you are, right? Yeah. You operate?
Yeah,
okay.
Every week.
So, well, we managed to transform in a lean expert that. And what are the resistances you found, Dr. Mateo?
Yeah,
what was that?
Oh, when we talk about with my colleagues, I want to say you that I am very proud of my team. I have 14 orthopedic surgeons, 3 specialists in rehabilitation, and 3 rheumatologists. And they are very good job. They have a very good job. They are extremely good in their jobs. They are my friends. But we have a very good relationship. But when we try to explain lean transformation, they say me sentences like this. This is not my problem. What? Patient's problem is not your problem? What are you saying? we are working very well. Oh, yeah, I know, because I'm working with you. And they say me, you can see the satisfaction survey of my patients. We have a lot of problems, and now you say that we must spend our time change our methods. Are you crazy? These are sentences that say me. Our patients aren't cars. This is not working with people. Oh, yeah. And they say me, it's an excuse to work more without more money, with less money. Oh, it's obvious because we have a great crisis. But I say, yes, I'm sure that we work very well because I work with you every day. But are you sure that you can improve? Oh, it's a good question, they say me. Are you sure that patients' problems aren't your problems? And I try to explain that for me, lean is a philosophy, is a way to work better. And it's the way who let us work the same with less effort.
So that is an important point, what he just say, because people think that doing lean is about, in the hospitals at least, it's about running, about doing more work, like in a fast way. And we explain that it's not about that. It's doing the same with less activities that add not value. So if we have the same time with less activities or less time to do that, we'll be able to do the job without running more and more. It's not about that. And so basically the people development was about training a lot to people and also developing the first pilot, the first small project, a small PDCA, so that we fastly achieved results so people, professionals, could see the first results. So training and seeing results that help us to engage professionals. And what about the leadership? What about the thinking we looked for from both facilitators and frontline staff, I mean nurses and doctors? Was important, these manager principles?
Okay, first of all, I think if you want to transform your organization in lean, you should choose a good leader, a good manager. First of all, leader should believe that change is possible, should believe in lean. The boss, in this case, and the boss is a facilitator. I never win my team. I never want to win. I want to success. And it's a difference. It's an important difference because as I say, they are always doing work in lean. Always are working lean, but they don't know. Because when we are doing PDCA in surgery, first of all, we plan surgery. Second, we do the surgery. And third, we check the surgery because patients say if this is good or not. And every day at the morning, we meet and check the surgeries that we did the day before. And finally, leader must think that my colleagues, the team, is the most important. The team, in my case, is a multidisciplinary team. There are different workers in different areas. There are nurses, there are porters, there are doctors, there are a lot of people, admission people, because they can apport, they can give us their own point of view in a process. And it's important because apport a horizontal cross-view approach. We establish a positive discussion in all the process, in all the piece of the process. And we should be respect for people, respect for ideas. I always say that if Christina has an apple and I have an apple, and share, she has an apple and I has one apple, but he have an idea, she has an idea, and I have an idea, and share, we have two ideas, okay? And imagine the potential with a team with 4, 6, 11 workers. It's very potential. And the leader has been an internal facilitator. Then we try to change the team principles. Now, if you remember the sentences, people's problem is our problem. Generally, we are doing our work correctly, okay, I'm sure, I am agree with you, but we can improve. We have problems, but we can solve our problems.
So another, one key factor was for each lean project developed, from the very beginning, we went to the Gemba, so that this is the only way to understand how the work is going on. And going to the Gemba is interesting because you not only see the gap, I mean the difference between how the process is working and how it should work, but also another interesting gap, which is what we think is going on and what is really going on. So that was interesting. I remember 2 weeks ago we were in the hospital ward, and so we were trying to do more efficient the process itself. And nurses were saying that they prioritize, of course, the visit and the attention to those patients who were living that same day, and they were very sure about that. So observing, we realized that that was not really true for different factors that, and mine at the moment, we won't explain everyone. But the thing is, now we know that this is not like this, that we are not being able, because the process is not working correctly, to discharge, to prioritize, the visit for those patients who were living. We were not able to do that, so at least we learn about that. So going to Gemba is interesting. Another important aspect was the use of the scientific method. It was a key point for us to use the A3 as a way of solving problems efficiently, as we don't have much spare time, right, in our lives. So when solving problems, we need to be efficient. And so we used the A3 and in order to create teamwork, and it was what Dr. Mateo said before. Actually, the A3, the PDCA, is what they do with their patients. They diagnose, they treatment, and they observe how the evolution of the patient. So it's exactly the same. And actually, deploying lean management in healthcare sector, we have observed that this is a very strong point, because they are scientists and they like this whole process. They understand it very good, and they like the thing of data gathering. So it's in this sense, it's more easier, maybe. Well, at least at our experience. And we've heard many times that lean is about common sense, and in a way, it might be, yes. But I say common sense with method, because we don't want to hear that we have been trying to solve this small problem for years and we are not able. And the question is, did you use scientific method? Did you use the A3? Because using it is about involving key people, creating really teamwork, but really teamwork, and not jumping to the solution. So it's interesting. And another key aspect was the communication. We knew that if we wanted to achieve involvement of people, we needed to communicate, to have a very robust communication process. So they had two ideas. One was to put all the A3s that were going on in the organization at the moment in one traffic area from doctors and nurses, so that they can see there all the activity, all the lean activity ongoing without being the information pushed, you know. And the other idea they had was to organize periodically short sessions, communication sessions, so they can explain on first-hand, professionals, what they were doing. And the attendance to these sessions was totally voluntary. So pull, again, not push. And it was a very good idea. It worked pretty good. And what about the lean projects? We are not going to explain two examples of projects developed in the hospital.
Yes.
And it was the approach.
We start, as I said, led by internal experts and managers, find a change agents in our organization, 50 people, and training by a sensei, by external training. Crisis arrived and look for a change lever, but we forget perfection. We only want to improve some aspects at beginning, start with pilots, get results quickly, and encourage the people who work in consortia. Fast, quick wins, suppose mid-long-term approach. I try to explain you two projects. First of all, it's operating room project. We try to, here you can see a A3, and we want to resolve not not all the problems who are in operating room. No, only waiting the time between two surgeries. Only this. Here we work as a team with surgeons, nurses, porters, cleaning service, very important, and have a precedence diagram and try to improve the time working like Formula One when change those wheels with SMET, as you know. We write instructions for every worker. You can start in this time and finish at this time, and work at the same time. For example, while anesthesiology is waking up the patient, at the same time, a nurse is preparing the next patient, and cleaning service are cleaning the theater at the same time, like Formula One with change. Go to Gemba and see.
It was about increasing the coordination with the team, and so that what he said, of course, it was proposed, this sequence, a specific sequence, this job instruction, because it's a job instruction actually, it was proposed by the same team through observation, through defining a standard 0, and the next day trying it in the operating theater, improving it, defining a standard 1, and all these little iterative cycles, right? So it was not about pushing anything. And so, for example, we identified, okay, once the cleaning staff has finished, once the wet, for example, is already dry, who's in charge for saying, okay, next patient can come to the operating theater. And there was no specific professional assigned for doing this. So with this observation, we observed that, okay, maybe, no, it's a matter of 1 minute. Don't worry, it's not take that long. But when observing in the Gemba, we realized that maybe it was sometimes 15 minutes, 20 minutes from the next patient arrived, and the operating theater was empty, and next patient was waiting. So the thing is, why we did that? Because we wanted to optimize the utilization of the resource. And why we want to do that? Because there's a huge waiting list of people, of patients, that we need to be operate. So that was one of the reasons of starting this project.
As you can see, the initial value was 60 minutes. At the end, we decrease a lot of time. The second example is emergency department project. As you can think, it's very hard project, but we only try to improve the waiting time to attend in orthopedic area. Only this. We make an A3, and when we observe and check the time and create a spaghetti map, we detect a lot of time invest in transportation and motion, a waste, and try to improve this aspect only. We change our circuit, we change the waiting room.
Was too much motion, 300 meters per hour. So instead of dedicating this time to patients, which is the value added, I still remember when I showed you the spaghetti, your spaghetti. You were like, so I don't need to go to the gym this afternoon because I'm walking.
For every patient, the nurse, I followed a nurse and take the time. I followed all the time. And writing the activities. And I'm very tired because she worked a lot. She worked 1 kilometer for every hour, or a lot,
Great.
and quickly. But only in 1 hour, only 5 minutes of value of work as a nurse. Only 5 minutes. Oh, it's waste. As you can see, waiting time was 42 minutes, and at the end, 26. And the doctors who I work, 3 meters at the end, and the nurses, 39.
So the main activities, the main actions here were about material at a point of use, because many times the material was very far, or the medication was really far also, and about really estimating, calculating the demand. You know, in emergency department, so physicians say that it is not predictable, the demand, but actually it's not really true, because if you analyze, for example, data for the last 6 months, you can perfectly, for each specialty, different specialties, of course, patterns. So from 8 to 10, there's few patients, and then, for example, from 10 to 12, a lot of patients. So we identify what was the takt time at the doctor should go, and how we could do so that it is possible for them to meet that takt time without, once more, without running, without being stressed. Okay, so, and what about the global results after 2 or 3 years implementing Lean?
Yeah. Well, as you can see, we improve a lot of areas in X-ray. We decrease the waiting in my service, in orthopedic emergency department. We decrease 50% the waiting of patients, and a lot of improvements, as you can see.
To do that is hard, very, very hard work.
Yeah, but
And
in this context, in context of crisis, the incomes was decreasing every year. Professional staff too, but only because not for layouts. It's only because they accomplish 65 years and go out to a hospital, and with less beds. Despite the crisis, we improve all our work, and this impact directly in our patients. This is the lessons which we are learning.
so we are very Lean freaks. So we will say that for every pitfall, we learn from that. We did a small PDCA, and now is a learning. And well, this is what you say, Dr. Mateo, before. Lack of leadership. We identify perfectly that small projects that did not have a leader didn't succeed. Maybe sometimes we try to analyze a lot of things at the same time. That happened also to us, so that project was not good. Assuming data without checking it, because we have the data in the database, in our system, and then you go to the Gemma, what we said before, and the reality is different, maybe. And of course, not leaving anyone out. I don't know if you remember, once in the operating theater, you remember the anesthetist?
Sí, the anesthetist,
He was
the chief of anesthesia is in holidays, and when he arrived, he understood nothing. What happens in my theater? And we need to begin again.
in my theater.
Yeah, in my theater.
That's just the point.
Yeah, but people is people.
So we had to start the whole Gemba process, analyzing process, again, the tools, the spaghetti with him. He had to observe, which is normal, right? Because otherwise, it's the way of involving people. And not only pitfalls, but the success factors.
Yeah. Lean is not about cost saving or layoffs or layoff. We start projects where there are problems to solve, no start projects. Well, we can improve emergency room. Oh, it's so hard. Only when there are problems. Start the first projects, always with the help of the leader. Leaders has been involved in the project and in the improve. Involve the professionals, not only the leader. The team is the most important. You and the leader has been to be a person who think that success, not win. And orientation, the action, small actions, fast, easy, and inexpensive. I am very proud of workers in my organization because we achieve fast changes in short term with a long-term sustainability because all the organization, all the workers are implicated in the improvement. Only with 3 tools, maybe it's not necessary more. And the last message I can say you that it's a present for you that you can take away. It's you can do it yourself. You only need training for it. Thank you very much. And if you have questions.
Thank you. I want to say thank you to Dr. Mateo for being here. Thank you because you had to cancel a lot of operations.
Thank you for the translators because it's very hard to work for them.
Tehát körülbelül 8 percünk van kérdésekre, és hátul már meg is van az első.
Yes, I will try to be first. My name is András. I work for GE, but I had a chance to work in many Hungarian hospitals. And my question is that it all sounds great, but how do you reuse steps when in the hospital I worked, it was one corridor, it was an emergency surgery unit, 70 meters long. One side is the operation theater or operation room, other side the rooms for the patients. And I worked there for 10 years and I don't see any feasible solution to change, steps what we need to make. So my question is, you implemented this, it works. Is there any chance that it grows to the level when a new hospital is being designed and being built? It is already considered that we need to design the rooms and the whole setup in a way that it supports the lean mindset. Do you see any chance that it grows out of your hand towards the government where they design a hospital? I know I picked the hardest question. I had about 10 more, but I picked the hardest one.
Thank you. No, yeah, we can scale that to, it's all about understanding the work, first of all, not that huge approach, the work. And if you understand how the process should be in a lean point of view, about calculating the demand, takt time, the flow, all about the 4 M's, right? The man, professional, material, method, and machines we use. With this 4 M, creating standards, we can know perfectly. We can, that's what's called a green file, right? And we sometimes did it. So it's about that, and then after that you can scale and you can communicate or whatever to the CEO and to, why not, to the healthcare government, so that they in concrete in Catalonia, in our area, now we are observing that more and more people from the government is starting to be engaged, interested, not engaged, interested on that, but because they have seen results. And yes, why not? I mean, if I understood your question, it's possible to define a new process in healthcare from this lean point of view. The thing is, in your case, that you didn't see never how to change it. We don't know. We should have to, in each case is different, but well, many of the times the ideas come from the professionals. So if you ask them, many people say that people don't have ideas. They don't want to participate, and that's not really true. We once participated in a project, and the big and best ideas came from the porter, which is a key
Yeah.
Also the doctor, but
No.
the porter.
The porter, it's important.
So
Because if you have no patients, you can do the surgery. All the people in the team is important, and this is the key. All the people have ideas. All the people knows her own area. It's important to believe that all the team can apport solutions and ideas. For us, it's the key.
well, I don't know.
Involve all the professionals,
Okay.
the clean service, all the people.
Köszönjük szépen, következő kérdés. És a másikat itt már két úr között el lehet osztani a másik mikrofont addig, igen?
Hi, my name is Robert. I'm from Avis Budget Group, and my question is, how has this transformation affected your daily routine, or do you feel that this has embedded a culture of problem solving in perspective of your staff or the visitors or the patients?
Affected? No more. Affected in very good actions, because for me, when I try to improve my daily work, I thinking in lean, and for example, I try to improve in my my action in the surgery room too, and it was good, because when my team see that I can improve my time in surgery, while I am operating, they say, "Oh, it's a good idea," because maybe changing only the different steps in my surgery, I can improve my time, and it's better for my patient, because there are no infections or less infections. There are less time with knee exposed. It's good. Only thinking in it's necessary do this action now, or it's better after. With little question, affect positive. It's positive for my because lean is like a virus, no? Infected a lot of people.
You are definitely infected. You are.
I'm Károly Sarkari from Osan, Hungary. Okay, you were talking about the results for your inner results, and my question is, what about the customer? Do you have any measurable results from the waiting, the queue, the waiting times, or
every year?
Customer satisfaction, or
every year we do a survey with the customers, with the patients, and every year is better. Every year, better in all the aspects: in hospitalization, in waiting time, in emergency area. Every year we improve this survey, the results. We do this every year. It's the same survey in the rest of hospitals, and we make benchmarking with the rest of hospitals.
But that's kind of easy, right? Because if you arrive to the emergency department and instead of waiting 5 hours, you wait half an hour. In this case, they did a survey, and so the satisfaction increased from 60% to 90%.
Yeah, but curiously, the workers are very happy, and then customers are very happy. With workers are happy, the patients are happy. It's the difference. We think in all the customers, workers, and in patients.
Okay, great. Thank you very much. Thank you very much. It was very interesting.
Thank you.